Access to the healthcare system with quality and equity is what every country in the world desires. The ideas and actions towards the collaboration among children, youths, adults, and relevant agencies in Thailand are the lessons for the world citizens from various communities, societies, or countries to learn from and share with one another, which will lead to the people's equitable physical and mental health status in their own context. Emerging health problems from regionalization. Location: Samut Sakhon Province. Samut Sakhon, a small province located at the mouth of the Tajin River, only 2 kilometers from the sea and 30 kilometers from Bangkok, is prosperous with a lot of agro-industrial, fishery, and tourism businesses. Thailand currently has about 1.15 million registered migrant workers, of whom 270,377 are in Samut Sakhon, in which the Provincial Employment Office undertook the registration of migrant workers on a pilot scale. With the rising numbers of migrant workers, one of the major health problems is their inaccessibility to the health service system. The Ministry of Public Health has thus issued a policy to include such migrant workers in the government health system, which will help stimulate the Thai economic growth while paying attention to the workers' health. Professor Dr. Rachata Nawin, the Minister of Public Health, said that in terms of policy, migrant workers are important to Thailand as they are essential resources in the economic system. Currently, the country is facing labor shortages in the sectors with jobs that Thai workers do not wish to do. According to the Thai policy on universal health coverage, state health services are available not only to Thais, but also to everyone else in the country, so that all are healthy. As for migrant workers, a migrant health system has been established, beginning with the registration of all of them for easy follow-up. Under the Migrant Health Program, a health insurance system has been set up involving the registration of more workers, and now many more of them have been covered. This is to make all workers and their families healthy. Samut Sakhon Hospital, a provincial hospital, is responsible for providing medical and health services to the Thai people, as well as migrant workers. The hospital's migrant health unit renders various kinds of such services to a large number of migrant workers each day in 4 aspects. 1. Physical examination. 2. Medical treatment. 3. Health promotion and disease prevention. And 4. Disease surveillance. In delivering such services, the core team members are migrant health volunteers who serve as a bridge of good communication for better understanding about health, disease prevention, and health promotion between health officials and migrant workers. The volunteers are the products of the School for Migrant Health Volunteers, which offers a training course for all migrant health volunteers so that they are able to provide basic health care, help with disease prevention, and pass on the knowledge about health to other migrant workers. Dr. Moli Wanitsuwan, director of Samut Sakhon Hospital, said that there are 2 groups of migrant workers, documented and undocumented, or legal and illegal, in the province. Documented workers will receive all kinds of medical and health services, but for undocumented ones, it is worrisome when they are ill and at risk of becoming disease carriers. For more than 7 years, the hospital has to bear the cost of medical care for migrant patients, totally amounting to more than 50 million baht, which is necessary to maintain healthcare efficiency. A Myanmar migrant health volunteer who can speak Thai said that he used to be a patient and received medical services. He thinks that communication is essential, so he turns to becoming a translator at the hospital to help his Myanmar friends who are seeking medical care. As a trained migrant health volunteer, he has a good opportunity to pass on health knowledge to other migrant workers. To work on health promotion and disease prevention, the state health sector alone is unable to accomplish all the work. So multi-sectoral collaboration is an important strategy that Samut Sakhon Hospital has adopted for its operations for over 10 years. Under this approach, the work is performed by its medical and health experts with capability, skills, and strengths in collaboration with other public and private sectors such as labor, provincial and local administration, civic groups, and non-governmental organizations. Most recently, Samut Sakhon Hospital has conducted a study on health promotion system development for migrant workers who are hard to reach and far away from the hospital. Such workers are fishery seafarers working on Thai waters in the province. Therefore, a boat health center project was launched based on the concepts of creating health program managers involving health status surveys and training of health program managers in basic first aid, use of household remedies, and prevention of sexually transmitted infections. Under the project, the trained boat health manager can proactively take care of sick seafarers as well as family members. This is the Ta Chalam Learning Center of the Rak Thai Foundation. Today, health officials from Samut Sakhon Hospital are doing physical checkup and providing vaccination for migrant children. Prambun Panichapak, Executive Director of the Rak Thai Foundation, a Thai non-governmental organization, said that previously there were no child caregivers, so the foundation had to establish a child care center for migrant children to learn about life skills. Later on, it was deemed that development activities were also needed for such children, and then the center was designated as the Learning Center so that the children can acquire the skills to live in Thailand. They also learn the Thai language, culture, and law, especially when the government allows them to enter the formal schooling system. But for those who are outside the formal system, the center will help them with such matters for their better quality of life, using the non-formal education approach. Generally, as a non-governmental organization with better access to migrant workers, we can build trust among them and encourage some of them to be migrant health volunteers. We believe that the problem of migrant workers' quality of life can be resolved by the collaborative efforts of relevant government agencies, business operators, and the communities. Here at the St. Anna Catholic Aid Center for Migrants, located in the compound of St. Anna Catholic Church in Samut Sakhon, Tachin Subdistrict. The center provides humanitarian assistance related to education and healthcare, and promotes cultural activities in the community for migrant workers in the province. The activities are supported by the Roman Catholic Archdiocese of Bangkok and regarded as social services in extending love to friends and underprivileged or marginalized persons, including immigrants. Father Wittaya Lodloy, abbot of St. Anna Catholic Church, said that migrant workers and their children in the province are in need of health services and justice at all levels. All of them need to be protected by law and entitled to the rights and justice. Female migrants and their children are to be provided with physical and mental health services, whereas the children also need education, guidance, and protection against child abuse in connection with child labor and child rights. Working systematically in a collaborative and multi-sectoral manner among public and private agencies at the central and provincial levels, including district and sub-district authorities, local government organizations, private businesses, non-governmental organizations, Thai village health volunteers, and migrant health volunteers, helps bridge the communication gap between the migrants and Thai officials, and enhances the efficacy of disease prevention and control efforts in a concrete manner.
ปัญหาใหญ่ของเราคือจะดูแลไงให้มีประสิทธิภาพ
Dr. Moli Wanitsuwan, director of Samut Sakhon Hospital, said, "We at the hospital realize that when migrant workers come to work in this province, it is economically beneficial to the province, but there are a number of negative impacts of such immigration, definitely one of which being related to health. As a state hospital, it is our duty to provide good health services for them, because they live and work here, not strictly separated from the Thai people. If we take care of only Thai people, neglecting such migrant workers, the people who will be negatively affected will be Thais. If the migrant workers contract an infectious disease, the disease will definitely spread to the Thai people. Taking care of migrant workers is regarded as humanitarian assistance, but actually such an action is the prevention of the disease from spreading to Thais. That is a major mission we have to continually pursue."